Hi, everybody. So today I'm talking about AI for automated processing of handwritten COVID-19 case reports. So this is a little bit less biological oriented and kind of more implementation and engineering oriented. This process from like start to finish is labor intensive at the point of this fax machines, but then additionally is really important because it provides the statistics that these public health organizations are going to be making their decisions off of. So having timely information in this process is pretty vital. Anyone who's worked in a hospital will tell you that fax machines are kind of everywhere, and that doesn't change in the scenario where there's still many health offices within the state and the country that are using fax machines as their primary means of communication. And that might be fine in normal times, but in COVID, where we have thousands of cases, hundreds of thousands of cases, this ends up being a bottleneck. So let's first take a look at one of these reports. So kind of a key thing about these reports is that they're very information dense. So this is a snapshot of part of the report where you can see you kind of have basic demographics about the patient, location information, and then kind of the reporting facility. And this information is really important because as it goes into the system and cases are confirmed, parts of the information such as the telephone number and the street address and the home address, as well as where they might have contracted the COVID-19, are important for contact tracing efforts and need to be done timely to prevent further spread and isolate cases. So this is the testing, tracking, and isolating that's kind of been considered the holy grail of how we get out of here prior to a vaccine or any other treatment being developed. Right. So if we go back to our overall pipeline and we replace this one individual with many individuals, we can see how quickly this is probably going to back up. And I think anybody who's been following the case reports has noticed that there's kind of these delays over the weekend where we see kind of a dip on Monday and Tuesday, as well as the weekend days. And then either usually Tuesday or Wednesday, there's kind of a spike. So part of that could be attributed to this kind of backlog of cases that need to be processed and then sent to public health officials so that they can then update those accounts. So if we can help as researchers, we've been in talks with the local public health office. And the idea here would be to kind of augment these humans that are going through these reports with an AI system or a neural network that can kind of process some of those reports. And I really add the plus here because I don't think that we're going to get to a solution that can kind of handle all of this information with no errors. But the hope is that we can get a partial solution in place that will be able to triage and even handle the easy ones for the individual, kind of lower that caseload for them. And then hopefully make this whole process smoother so that our public health officials can operate with more timely information. So first thing we did looking at this was kind of ask ourselves, are there open source solutions that are going to be sufficient? So one of the things that I was kind of surprised with going into this was that these open source solutions aren't actually that robust, especially for handwriting. So they're kind of primarily built for typed text like you might see in a PDF form. And there's no built-in ability to handle checkboxes. And so that's not going to work for us. So we're kind of going into this kind of building our own system from the ground up. And kind of one of the couple of the more challenging components of this are that we can't really rely on some of the other things that these OCR systems generally use, where you kind of, if you're parsing a document related to like maybe research journal, you kind of have a sense of like what kind of words might be in that vocabulary. But here we're dealing with names, we're dealing with locations, we're dealing with street addresses. So those aren't really the same kind of closed world scenario. So we can't really rely on kind of these little tricks to get like beam searches or closed vocabulary searches to kind of improve the performance of the model. So it's a little bit more difficult of a task. So the first challenge too that we run into as well is that this data is all personal health information. So it's protected by kind of patient confidentiality, as it should be, and data use agreements are kind of long and tedious, and we want to kind of see if we can get a system in place that's working using only synthetic data. So if this is the report that we have here, we've done work to kind of build out one Python program for essentially filling this out with fake information. So trying to sample as realistically as possible, last names and first names, locations, checkboxes, and then passing that through to a separate program that we wrote that does kind of a synthetic handwriting. So having done that, you would get something out like this, where you can see these names have been filled in with the synthetic handwriting. Looks pretty good. Maybe a little bit more pixelated than we would expect from human handwriting, but that might be noise that we get through a fax machine process. So the goal is then to train models on this to kind of get baseline performance in place. So currently we're still in the process of building these models. And then there's also a component to this so that we know synthetic data is not going to be enough. So we want to get some real test data. So we took the Python report generator program that we had written before for the synthetic data, and we're actually going to generate a bunch of reports, pass that off to a group of doctors, so a small army that Ahmed has been gracious enough to recruit for us. And then that group of people is going to go ahead and write us out reports. So this is an example fax that we would see where this is actual doctor handwriting. So next steps overall are going to be kind of assess these final models on this real test data collected from individual physicians, and then we're going to kind of coordinate with the local county health officials to integrate that model into their workflows, and then hopefully we can have this be an ongoing situation where over time we continually improve the model to then provide more and more support over time and need less intervention by humans.